For the two people that speak English here, I prefer information bias than selection bias, so I'm going to try to speak English. I'm a better speaker of Portuguese than English, but that's life. So, as Guilherme was saying, my name is Diogo. I have a background in medical school. I'm also an engineer, but I never actually worked in engineering. I have also other backgrounds, but this comes, well, my first slides weren't out the window already. Let me just check. Okay, yeah, because I was going to start with me. So I'm mostly here because of the background in the certifications I made here. So the foundational level, the intermediate level, and also the generative AI certification. But that's the main focus for me, which is my medical background. And why is this? As you're probably aware, medical school is thought out as one of the toughest there is. 6 years hard studying, but the truth is we end up with lots and lots of information and knowledge regarding medical topics, but little else, including critical thinking outside of medical diagnosis and interventions. So this was actually awkward for me. I was also in engineering, but it's also a bit of my profile. I needed to know how things worked and how I could access this information. It's one thing to have a textbook or having a supervisor telling you it's to do this or to do that, and this is why, and if you have this question, you go through here, which is actually like training a model. But that's not very humane. So this is regarding, okay, so I had some background already, and I started to try to deconstruct all of this during medical school. So as you know, we have lots of fields and we have to do lots of works. And curiously, in 2015, we had lots of works available to choose in therapeutics. But one of them was regarding the reception of stroke patients in the ER. And we wanted to try to, study the problem firsthand. We knew we had a problem, or we suspected that was not quantified. So nobody actually could try to tackle the problem because there was no background in either medical students or even medical doctors. So this was actually my work back then. This is a screenshot with mistakes included, but again, in the land of the blind. So the work went forward, and it's actually a lot of what was taught during the certification in the foundational level and also in the intermediate level, which is to try to translate information in its various steps into actual and attainable information and insights. So this is a classic for any medical doctor that works in the NHS in Portugal. You just write here, okay, what are the symptoms? What did I objectify? What is what is the main diagnosis or the suspect? And what am I going to do about it? The big trouble is it's mostly text. So we tried to fill it a bit with some codes already, but back then it was very archaic. So first, how do we translate this into this? Okay, we have to have some critical thinking. We have to make some decisions that need some background. But we also need to know, okay, so if I don't have information, how should I code it? Okay, so if I have an outlier, what do I do with this? It just gets out. Do I go to the maximum? Do I go to the median? Do I go to the average? This is knowledge that is not normally available in any kind of medical professional. Okay, some have it. I'm talking about the average here. And with all this information, we tried to get some results back then. This was the first work that, at least to my knowledge back then, in my school was made, trying to tackle a problem that was not so immediate regarding either a surgical intervention or maybe about some drug that was being tested. This was my main conclusion back then. On average, okay, we lacked the skills. So I finished my course in 2016, and in 2018, I started my public health residency, which is a specialty that's actually, or wasn't very known, mostly because what we do is not perceived by the public, except that in 2020 something changed, which was the COVID pandemic. So this is a photo when we had actual meaningful visibility and people knew what we did. Why am I bringing this up? So as you know, in March 2020, the pandemic started, And we needed information. It was new. Nobody knew anything. It was to do this. It was not to do that. I have to check on my patients. I have to check on people that were with my patients. I need to know if they wear masks, if they wash their hands. And we had no information system. We needed to register the information. So what you see this is the work of an Excel champion, that, as we spoke earlier today, to try to do something, because we needed a solution in the moment. An hour that passed was 1 hour information lost. And nobody could do this. Afterwards, okay, so I'm not working alone. I need to work in a network. So I need to tackle the problems of my team. Okay, maybe this makes sense for me, but I need to try to help people fill the information that is needed. So this was our information systems. This is how we tackled information. And fortunately for us, the SPMES took only 2 months to give us something that did not work. And when 1 year had passed, they gave us a solution that was worse than the one we had. So it was meaningless also. Sorry. And this is where I want to go. So public health had had a very important role. One of them was to communicate with our partners in the community. So how can we do this? We need to give them the insights, the knowledge. And this is something that's also not usually present in the medical community. This was something we did back in Matosinhos, where I worked, was pioneered, and we had no trouble anymore to report weekly with a PDF to our partners, be it the police, be it the municipality, wherever. We had to translate this from the information you saw previously. So we had to try to optimize everything. Still during the pandemic, because this was our reality in Matosinhos, we had also the regional sections. And this is also something that is not usually present in medical doctors. Excel can't handle quickly with millions of lines of data. So we needed something else. We needed SQL, which was something that was learned out of the box with lots of nights trying to study. And finally, another example in the residency, which was something that's called Plan Nacional de Saúde, which is a document that takes what is known about the health of the population and tries to set the health objectives, what are our goals and what strategies are we going to implement. This is done for this plan until 2030. I was part of the team that was involved. As you can see, we have some forecasting models that were implemented by us without a lot of knowledge of the subject. But the previous ones, the logic was you take the ruler, you make a line between all the points as close as possible, and that's probably where we're going to be in the year, fill it. So no kind of data knowledge. We did our best to try to avoid selecting bad models. But in 2022, this was, for me, the breaking point. So this was my last days working as a medical doctor in public health. The pandemic was over. I was tired of working for the NHS. So the only thing I could reasonably do was go back to school. One of the things I went to was the program that Guilherme talked about, Managing with Analytics in Católica. And I also knew one thing, that was I was going to try my best to fill the gap I saw. This was something that Guilherme already showed. I didn't know it was coming for. So the 3 certificates I did here. And this was my main endeavor in January of this year. So I knew medical doctors, medical students, nursing doctors and nurses could not handle data very precisely. So we started with a business. So I need to fill a service. I needed to have the know-how and to discuss everything. So knowing data science was critical. This was one of the last databases that was sent to us by a client of ours. So what was everything that we could do for our client? First, we knew how to see the data. We knew how to manipulate the data, and we knew exactly what kind of tests or analysis were needed. We usually use a lot of statistical analysis. Sometimes, not always, we can go to forecasting and such, but that's the main plate usually. And also one thing that's related to data science, and that I still have not found a way to ask ChatGPT to help me with that, which is the questions not asked. Because our clients usually don't know the data they have, or how they collect it, what kind of bias are there. So we have also another kind of work to do in the background before setting ourselves. And honestly, and this is the main topic, this is what gets me really thrilled. GPT. In the previous presentation, I'm basically in the classroom. I'm a 5-year-old exploring this, but it's being loads of fun. So this is a prompt. Knowing how to prompt was something that was very helpful, and I believe I'm always increasing my skills. My clients are badly paid, so I can't ask them a lot of money. So I have to improve my efficiency, and that's what GPT is doing for me. So we've been doing a lot, not to know the simple questions. This is R, and it's basic R, but it's helping us in constructing more advanced questions that help me to automatize everything I need right now. The same way, and I'm probably out of time already, this is another thing I did, and I'm almost up. In public health, we usually have a lot of travel medical appointments. So if you want to go outside of Europe, you usually need, or it's recommended to have a travel medicine appointment. You might need a yellow fever vaccine. You might need to know about malaria. You're going to high altitudes and you don't know what to do. So I knew a lot of that, but I lacked the skills to go forward. So fortunately for me, I had a co-pilot already, which was called GPT, and I had a lot of curiosity. I didn't know how to build websites, so I asked him, how can I build a site in WordPress? How can I keep my costs to a minimum? What kind of plugins should I use? The images? DALL-E. How do I use forms? One of the objectives I had was to try before coming here to have a chatbot for my possible clients. Unfortunately, it's still ongoing. This is very recent. And another thing that's been helping, not me, but through me, other people, which is image. So a colleague of mine is launching a new service, which is called Tabus. She has some trouble finding someone to help her, and I'm absolutely the worst person to ask for an Instagram post. I don't use it. I don't know everything. So I know the information, and I know who to ask. So this is what I asked, what I gave him. This is what I asked, even give me the suggestion for the visual. And in the end, this was what was done by my colleague. So everything here, it's with our very helpful GPT. I thank you all for your attention. I know this is a bit out of the box for this kind of event, but I thank you for the opportunity to share my experience.